Good afternoon. Thank you all for coming or joining us by the phone. Since yesterday, in Alberta, we've had 31 new cases of COVID-19. This means that 226 cases have now been identified in our province. We suspect that up to 16 of these cases may be due to community transmission. 11 individuals are now hospitalized and 6 are receiving care in ICU, which is 1 additional ICU admission since yesterday. There have been no additional deaths. The number of recovered cases was 3 yesterday, and we have not received an updated number today. I want to reiterate Dr. Hinshaw's gratitude to all Albertans for continuing to take the necessary steps to slow the spread of COVID-19 in our communities. I know these steps may be particularly difficult on the weekend, when many of us would normally be out and about with our family and friends. For many Albertans, weekends mean fellowship in their chosen faith community as well. Worship service may still take place, provided gatherings are less than 50 people, and provided those who attend in person practice social distancing and proper hand hygiene upon entering and exiting the building. Anyone who is ill, even with mild symptoms, must not attend. I want to thank Albertans for continuing to prioritize the health of the most vulnerable members of our society by staying home whenever possible, practicing social distancing while you're out, and reaching out to your loved ones who may be struggling with loneliness and isolation. Seniors may be in particular need of support during this time. At this time, as you reach out to your elderly loved ones, please remind them to be vigilant of online or phone scams. In particular, please know that no one from Alberta Health or Alberta Health Services will be calling and asking for social insurance numbers, credit card numbers, or banking information. We must continue to look out for one another and work together to prevent the spread. Today, you may have seen that some prominent Albertans are also sending that same message. The Help Prevent the Spread video is a great reminder that we must all work together to decrease the number of people becoming ill and to reduce the speed of spread of COVID-19. This is called flattening the curve. The video is posted on Alberta government social media channels. I know Albertans are taking these public health measures seriously and taking necessary steps to prevent the spread despite the disruptions to their daily lives. Thank you for your efforts during this extraordinary time.
Great.
Thank you.
Thanks.
Just want to start, is there any recommendations for when it comes to shopping responsibly? I know a lot of stores have put limits on how many people can go into the store, but is it wise at this point that people go in alone as opposed to maybe going with family or a significant other?
We ask that people do the best they can under the circumstances. If you're within 2 arms length of the person that you live with, that still would be included in being within the social distancing parameters. But when you're with people that you don't live with or share space normally with, then you really should do whatever you can to keep with not closer than 2 arms lengths. So it's hard to say each and every store should do any particular thing. We're asking all stores to do what they can to decrease the closeness of people in their store, and we're asking people to do whatever they can to maintain that social distance space 2 arms length away.
Today we have 31 new cases. Yesterday we had 49, I believe. Mm-hmm. If I'm not mistaken, this is the first time we've had less than the day before. Is this maybe a silver lining that people are following the rules and we might be in the right direction?
You know, we sure hope so, but I must say it is too soon to make that conclusion on one day's information. The whole aim of all the social distancing restrictions we've put in is to decrease the number of people getting ill and to decrease the speed at which they're getting ill. The numbers add up. So if this is an indication, and I'm not saying it is, it's only one data point, if it is an indication, that'd be great. That's what we're working for. It's too soon to make that conclusion at this point.
Okay.
Two more questions. I wanted to ask, are any of the cases that we've had so far in seniors' homes in Alberta? And if yes, could you let us know which ones?
We do have a report that we have one recognized case in a seniors' home today. We will not be telling you which seniors' home at this time. That's mainly to protect patient confidentiality. We must say that the continuing care operators have been wonderful in terms of increasing their vigilance for any respiratory illness, isolating anyone who's got any respiratory illness, and testing anyone. So we're optimistic that this can be controlled, but we will be watching very carefully, and everyone's working hard to control this.
Okay, go ahead.
I think this is a question for Dr. Joffe, but the CBC came out with a report this morning of a bit of nurses walking out due to some differences in opinion between the union and AHS. I was just wondering if we could get a comment on that.
Good afternoon. Thank you for the question. Yes, there was a small number of nurses this morning, as I understand it, that felt they may not have adequate protection, and as is their legal right, they made a choice not to provide the care that was being asked of them.
Okay, I think we got a number of questions on the phone, so I'll turn that over. Operator, go ahead with the first question, please.
Thank you. Yes, the first question is from Chris F. of CTV. Your line is open. Please go ahead.
Thank you. A question and then a follow-up. My first question is, I know a lot of viewers told us today they're in the mountains, they're in parks, they're seeing a lot of people out there. Now, presumably they're trying to abide by that 2-meter spacing, but what do you say to people who aren't following those rules, and do you think there needs to be some sort of actually enforcement? I know Manitoba's fining people now. At what point does that become an expectation to require people to keep their space?
That's a good question, an interesting question. Yes, I think that people being outside, number one, people being outside is probably a good strategy just to get out of the house, but you do have to maintain the social distancing from people that you don't normally live with. So it's good that people are out and about. Great if they're maintaining the social distancing. There are reports across Canada of people not following the advice. Here in Alberta, we are receiving some of those reports. A plan is in place and will be starting to roll out over the next week that would allow public health inspectors to monitor large groups and restaurants and businesses. There's also power being provided to the police to deal with, through fines, I believe, with people that might not be following the recommendations. But we are counting on people doing what they can for themselves, their families and friends.
Thank you. And just as a follow-up, last week we had some confirmed cases in the school system here in Calgary. I'm just wondering if you can update us on how, if you have a ballpark of how many kids are infected right now, how they're doing. I know in the past you've said that the symptoms seem to be not as bad for young people. What's the status of the sick kids in Alberta right now?
I don't have those numbers with me, but we can get them to you. The age group that's most affected is in the 50s and 60s. It is not children, but there are children that have become ill.
Okay. We'll go to another one on the phone. Operator, can you patch through another call, please?
Yes, the next question is from James Keller of the Globe and Mail. Please go ahead.
Hi there. You say that there's a plan in place to provide police with the ability to issue fines and that sort of thing. Can you talk a bit more about when that would be in place? What level of fines are we talking about? Exactly how that would work?
At this point in time, I don't want to give much details because I think that there's still some work on all the details, but it will be rolling out next week.
And is there any concern, or how do you balance, you're looking for community buy-in and having people on board with these measures, but if you're talking about using the police, is that going to sort of undercut just people's ability to participate and to kind of have the buy-in you're looking for?
You know, we don't think so. We think that's just part of the picture. When people are asked to do something that's difficult, and everybody wants to do the best they can, but there are some, unfortunately, that don't always go along with the restrictions. To make as much cohesion in the society as we can, it is nice to have a mechanism to nudge the reluctant people more towards helping keep all our communities safe.
Okay, go ahead.
Are any of the confirmed cases like part of the homeless population or those with no fixed address? Do we know?
We are watching that very carefully, and at this time, we are not aware of anyone.
I think we still have a number of questions still on the line. So, operator, can you patch through the next question, please?
Yes, the next question is from Alana Smith at Post Media. Please go ahead.
Hey there. Thanks for taking my question. I also have a follow-up. Just wondering, of the 221 total cases here in Alberta, how many of those are linked to the Pacific Dental Conference in Vancouver?
At this point in time, I don't have that number, but there are a handful of cases related to the dental conference in Vancouver, here in Alberta.
And maybe just a follow-up to that, I was just talking to BC earlier, and they said that they let people know immediately. It was, I think, a few days after the conference. We, of course, took a little bit longer to notify all of the dental professionals here in Alberta what was happening. So I'm wondering, how is the province tracking attendees that are here in Alberta that were at the dental conference, if at all?
We have worked through the dental college to make sure that the people are aware. We have also worked, as soon as we found out about the first case, part of the normal investigation of any positive report from the lab of a person here in Alberta who has COVID-19, there's an investigation done right away. We find out where the person had been during the time they may have got ill. In this case, the organizers of the particular conference, the dental conference, would have been contacted, and a attendees list would have been obtained, and that attendee list would have been kind of given to different provinces depending on where the attendee lived, and each case would be followed up.
Okay, we have time for one more question on the line, and if you patch through the next question, operator.
Thank you. Yes, the next question is from Kevin Berger. Your line is, please go ahead.
Hi, I'm actually inquiring. Yes, last count, there were 17 cases of COVID-19 within the North Zone. Now, obviously, the number of cases has gone up. I'm wondering, would you be able to update that number in terms of the number of cases within the North Zone?
I can, but not at this minute. I think we can get that information to you.
Yeah, there'll be a regular situation report coming out momentarily that'll have the updated numbers and broken down by zone.
Sounds good. Can I ask a quick follow-up question? There have been, my newspaper specifically represents the Barhead area. According to Alberta Health Services information, there have been 2 cases confirmed within the Barhead, I'm assuming the county of Barhead. Without giving specifics, obviously you can't say names or anything, but can you offer any general information about those 2 cases? Like this was a couple that just returned from travel or something like that?
No, at this point in time, the level of granularity, the level of detail that we want to get in about the location or the particular characteristics of people in general are limited to the geographic municipal area.
Okay, I think we got one more question on the phone, and then we'll take one last question here on the floor. Okay. Operator.
Thank you. The next question is from Emily Mertz of Global News. Please go ahead.
Thanks for taking my question. I'm just wondering if the parameters for testing have changed since there are now several more cases that are believed to be community transmission. For instance, if someone has, not mild symptoms, but obvious symptoms, but hasn't traveled recently, but perhaps works in a high-traffic environment like an airport, obviously they would self-isolate, but would that contact tracking not be launched because they haven't been actually received a positive test?
As soon as we have a return travel, we do talk to or give general advice to return travelers, and definitely follow up anyone who has symptoms that is a return traveler. Up until this time, international travel has been our largest risk, and indeed it remains our largest risk. However, you are correct in that we do have some evidence of community transmission of COVID-19. So there will be a shift over the next week to managing both the return travelers and getting a good and improving handle on people in the community. Our lab has been doing a tremendous job to date, but even our lab has limited resources. So we have to carefully switch the emphasis of our testing and the target of our testing, but not leave behind the returning travelers. So that will be gradually shifting, or that will be shifting over the next week.
Okay. Last question.
Thanks.
Oh, sorry. Oh, did you have a follow-up or? All right, okay.
Okay. You spoke about how like people should go outside and stuff. So I just want to know, Parks Canada suspended their services, right? The weather's getting nicer. There were a lot of people out today, actually in Harley Park. Like someone told us that they were out barbecuing. Is there a concern at all that parks will get a little bit more crowdier as days go on? And will there be any measures put in place to kind of block that from happening?
You know, we're fortunate here in Canada, even in Edmonton, that we have a lot of green space. People can be out, and I think we've got room to have our 2 arms length distance and still enjoy the outdoors, walks, barbecuing, probably with friends that you, or not friends, but people that you live with, so that you're not putting extra people at any risk. But at this point in time, we haven't had any indication that we'd have to limit the activity outside.